Greetings, everyone, and welcome to the Haelan Nurse Chronicles podcast. I'm your host, Dr. Lori, and for those of you who are just tuning in, I am an author, a nurse scientist, an educator, and a trauma burnout expert. I am so happy that you're here. Today, we are diving into a critical topic, and that is resilience. And it is a hot term right now that millions of nurses are feeling gaslit by. Well, and for good reason, because resilience, as currently touted, fails to address the substantial and oftentimes avoidable trauma exposure that nurses endure, frequently secondary to system or organizational inadequacies. The resilience concept came to the forefront amid the pandemic. Organizations and healthcare systems are pounding the resilience drums to the point where many nurses feel like it's falling on deaf ears. Rather than focusing on the system or the organizational or setting factors that are taking nurses to or beyond their capacity, the mainstream messaging has shifted the focus, dare I say blame, to nurses who should essentially suck it up buttercup. I pulled a few examples of memes from pop culture that talk about nurse resilience. This one says, to those in scrubs, your resilience is the backbone of patient recovery. Well, we're going to talk about that in a minute. And here from Sigma Nurses, we have the definition of resilient is to adapt well in the face of adversity, trauma, or significant sources of stress, able to tolerate disturbance without collapsing, rebuild when necessary, and improve when possible. Well, media and social media are replete with resilience artifacts that imply that there is an infinite wealth, an unending reservoir of resilience within every nurse. That is a fundamentally flawed assumption. The assumption is that no matter what happens, no matter how much stress, how much trauma exposure, no matter how bad it is, nurses can always dig a little deeper within to be the backbone of patient recovery. Well, guess what? Every nurse, every human has limitations, has a breaking point. In current practice conditions, we aren't talking about the stressors that are inherent with the profession. We're talking about substantial and avoidable nurse-specific trauma exposure that is almost always attributable to system, organizational, or setting inadequacies. So let's unpack the resilience term and really examine it through the lens of Porges's polyvagal theory. Let's start by using the American Psychological Association's definition for resilience, which is, and I quote, the process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, and behaviorally flexible and adjustment to external and internal demands. Well, that's a whole lot, that's a whole mouthful, but there it is. So with that in mind, let's check the popular assumption that is frequently used to gaslight nurses, is that we have an unending, infinite well of resilience within any of us. Now, there's a chart that's widely available, and I think it's from Deb Dana's work. She's a licensed social worker and a master applicator of the polyvagal theory. So for those of you who aren't familiar with polyvagal theory, there's a hierarchy of responses from the midbrain, which processes neuroception, which Porges refers to as the threat detector, which has one job, and that is to keep you safe. Every waking nanosecond, The threat detector scans external conditions and triangulates them with internal conditions, including similar experiences or traumas that are fully or partially healed or unintegrated, what I like to call unhealed bits of wisdom, because they get stored in the body until conditions are favorable for healing. Now, the threat detector signals to the autonomic nervous system and or the ventral vagal aspect of the vagus nerve and or the dorsal aspect of the vagus nerve. Now, we all know the autonomic nervous system and vagus nerve are huge physiological modulators that drive physical, emotional, behavioral, and social responses. So as nurses, our role is to be fully present with those in our care, to deliver safe, high-quality, heart-centered, patient-centered care. Now, for a nurse to be optimally present and open, the external conditions, excuse me, must be perceived by the threat detector as being safe. If conditions are perceived as safe, then a signal for the ventral aspect of the vagus nerve comes online. And we will post a chart and everything you need to see visually. If you want to connect visually, just visit drlorilaws.com/14. drlorilaws.com/14. And you can follow along visually if you, like me, are a visual processor. So let's say for the purposes of this example that you're coming to your shift and you're getting a report and the unit is calm. The patients are settled in for now. Chances are your threat detector is scanning and detecting a relatively safe environment and signals for that ventral vagal circuit to come online. You're feeling grounded, open, comfortable, present. In other words, you're calm, cool, collected, and connected within and with others. But the day starts ramping up, as does the stress level, as does the trauma exposure. No problem. We're all hardwired to manage the stressors of daily life, and even the stressors of nursing, absent the avoidable trauma exposure. The threat detector under these conditions will signal for the sympathetic nervous system to come online to address these stressors. So in response, you're probably feeling a little more alert, a little more activated. You're in the I can zone, meaning that the stressors are perceived as manageable. And this is, if you're following along with the chart, this is reflected by the lower part of that red zone. So what should happen in a nurse's practice is that the stressors and the trauma exposure should be such that we can vacillate between that ventral vagal on the green part of the graph, ventral vagal tone where we're open, we're calm, cool, collected, and connected, and that sympathetic I can activation. Oop, there's some stress. Oop, there's a trauma exposure. And we should be able to navigate between these two states in what is known as ventral vagal tone. And that's where nurses are ideally practicing within their window of tolerance. Nurses should primarily be practicing from the window of tolerance, for that is the place where they are the most present, open, compassionate, and mindful. There would be a whole crap ton less of medical errors, near misses, adverse or sentinel events if the healthcare system, organizations, and settings would prioritize nurse safety and professional well-being. But that is not the case. Instead, nurses are burdened with more and more stress, more and more trauma exposure, most of which is avoidable, under this false assumption that there's an infinite well of resilience within each of us. We should just do more with less, do more with even less. It's a common mantra in healthcare these days. And nurses are doing amazing work despite harsh practice conditions, but they can only do so much for so long with so little. And as that stress and trauma exposure presses on for days, weeks, months, and now even years, it takes a huge cumulative toll. Nurses are primarily now practicing from a place of what I call sympathetic overdrive. They're locked in to that I should, I must zone in the chart, that red area. Nurses are practicing, they're so overworked, they're so stretched, so thin that their sympathetic nervous system can't sustain them. It can't keep up physiologically or emotionally. And nurses reach the point of overwhelm. And when that happens, they approach that I can't zone. And for those of you following along on the chart, drlorilaws.com/14, then you are starting at the bottom of the blue zone of the section. And physiologically, that dorsal aspect of the vagal nerve comes online because there is not the mitochondria, the powerhouse of each cell, production of all energy in the body cannot keep up with the demands. And that's the point where resilience is not infinite well. It's a limited, finite resource. So when the threat detector signals for that dorsal vagal aspect of the vagus nerve to come online, it starts shutting us down to conserve energy. The mitochondria literally cannot make ATP fast enough. The stressors and the trauma exposures are simply too great. Millions of nurses are practicing in an overwhelmed physiological state, feeling hopeless, shame, guilt, shut down, depressed, helpless, and the list goes on. And this is why nurses are leaving the profession en masse. It's not because they're burned out per se. There's only so much that a human body physiologically can do. We are not built for hyperacute levels of stress on a chronic life timeline. We aren't built for sustained and inordinate amounts of trauma exposure. If the mitochondria can't keep up, then we have a much bigger problem because that leads to oxidative stress. And if it persists, the trauma exposure, the excessive stressors, if oxidative stress continues, it leads to, according to Robert Naviaux's cell danger response theory, just to cite my source, it leads to metabolic rigidity and a host of other metabolic related chronic health conditions. Mitochondrial dysfunction is what we're talking about. So I'll drop a chart in the show notes that describes how this happens, with my immense gratitude for Dr. Robert Naviaux for bringing forth that cell danger response theory. It is a game changer. So to be clear, the limiting factor where resilience is concerned is that there is not an unlimited supply of resilience within any of us. And it's inversely proportional to a host of homeostasis altering stressors. Among those stressors is nurse-specific psychological trauma exposure, most of which is avoidable. So until health systems, organizations, and units get to the root cause of resilience challenges, the mass exodus of nurses will continue. Practice conditions are so unsafe that nurses are being affected right down to the level of their mitochondria. Let that sink in for a minute, down to the level of the subcellular organelles. That's big. But there is hope. There is a pathway from surviving in practice in the ways that we've talked about today to thriving in it. It is mission critical for nurses to learn how to insulate themselves from these harsh practice conditions, to learn the language of their autonomic nervous system and their vagus nerve so they can practice within that window of tolerance, that ventral vagal tone safely. I discuss this and so much more in my book, which is titled Nursing Our Healer's Heart, a recovery guide for nurse trauma and burnout, which is available to order wherever books are sold. So please stop by my website at drlorilaws.com/book. And if you'd like to learn more about if and how you are being affected, please take my 5-question, 30-second self-survey, and I will send you a detailed report outlining how you've been impacted, along with the steps that you can take today to start your healing journey. You can find that at drlorilaws.com/burnout. Nurses are incredibly resilient people, or we would not have made it through nursing school in the first place. But there is not an infinite well of resilience within any human. It's not about resilience. It's about the need for safe and supportive working conditions to ensure that every nurse is thriving within their window of tolerance in ventral vagal tone. For when nurses are thriving, patients do too, by the way of improved safety, care quality, and outcomes. Safe and supportive working conditions, not resilience, are the backbone of patient outcomes. Until next time, thank you. Thank you for all that you are and do. From my healer's heart to yours, namaste.